Hello. Welcome to ICUBA's 2021 Brand Partner Whole Person Approach.
You may remember us from last year. This is Skylar. Over the last year, the ICUBA brand partners have continued to work with both of us.
I'm Ted, an employee in the Jacksonville area. I work really hard and continue to struggle to keep my diabetes under control. I've had some unexpected twists and turns to my journey this year too.
As a newish college student, I'm learning to live on my own, although I have some current health challenges.
Let's take a look at how ICUBA's brand partners have been able to provide Ted and Skylar with the best possible experience for the whole person approach.
I've been treating for asthma and an annoying knee injury. My mom always worries about me, and I miss her a lot, but I'm trying to be an adult and do what's right. I guess that may be part of why I'm so stressed. I am looking for options on how to best manage everything I'm dealing with, including isolation from the pandemic.
Hi, I'm Sherry from Blue Cross Blue Shield. Skylar has been participating in the Blue Cross Blue Shield Health Coaching Program and engaging with a respiratory therapist since last year. She started engaging with a Blue Cross Blue Shield respiratory therapist when she first went away to college in an effort to appease her mother. My job as a respiratory therapist and health coach is to assist members like Skylar deal with their chronic conditions. During a recent call with Skylar, I could sense she was struggling emotionally. We asked if she was open to speaking with someone from Aetna Behavioral Health about how she was feeling. She agreed, and I was able to warm transfer her to Aetna.
Hi, I'm Amy from Aetna Resources for Living. Blue Cross Blue Shield health coaches successfully transferred Skylar to our team after recognizing that she was struggling emotionally. I assured Skylar I was there to help and support her through how she was currently feeling and assist in the process of getting on a path to feeling herself again. I immediately began providing Skylar in the moment support while helping her locate a provider for counseling. We also identified a few support program groups she could attend. I explained through ICUBA's Employee Assistance Program, she could meet with her counselor 6 times for free. If additional sessions are needed after the initial 6 sessions, she could transition to the Aetna Behavioral Health benefit and continue with her counselor. After getting Skylar set up with resources in her area, I explained the digital tools and resources available to her through My Strength and offered to help her register for access. Skylar was relieved to have access to programs like Aetna Resources for Living and My Strength, which provide her with resources to help her build resiliency, manage stress, control depression, and even manage her pain.
Hi, I'm Dr. Jones from ICUBA Cares. Over the last year, I have been working with Skylar regarding her asthma. During one of our conversations, I noticed Skylar was taking 2 medications, one for pain and one for depression. Skylar was curious about alternative methods for pain management because she was concerned about interactions with her current medications. While reviewing Skylar's medication list with her, I reassured her the pain medication is perfectly fine for her to manage her pain and let her know OptumRx has safeguards in place like quantity limits and prior authorization in an attempt to prevent addiction. I gave her some tips on how to manage side effects like irritability, constipation, or increased drowsiness, and provided her with some educational material and resources about Optum's opioid medication management program. I also explained one of the medications she was taking for her asthma, an inhaler, was known to cause dry mouth and reminded her of the importance of regular dental visits. Skylar mentioned she was enrolled in her family's ICUBA dental plan with Delta Dental, so I forwarded her some electronic material from the carrier on the importance of dental care as an asthmatic.
Hi, I'm Blake from Hinge Health. After learning about our program through an ICUBA-sponsored on-site event, Skylar's mom forwarded her our recorded session so she could learn about the new ICUBA program, which offers alternatives to traditional physical therapy for her chronic knee pain. Because Skylar is over the age of 18, she met the eligibility requirements as a dependent. From the recorded session, Skylar got all the information she needed to access the website, complete her assessment, and registered for the program. Once accepted by the Chronic Knee Program, Skylar was assigned to me as their ongoing health coach to provide support and keep her engaged in an at-home therapy. Our team sent her a welcome kit which included a tablet, knee straps, and exercise bands, and I worked with Skylar to create a personalized exercise therapy plan. Several weeks later, Skylar completed her exercise therapy and was feeling better about her knee pain. We talked about the stretches she learned and how she could incorporate them into her daily lifestyle. However, we decided it may be time to explore surgical options for her pain relief. I coordinated a referral and completed a warm transfer to the ICUBA hub at Surgery Plus to help Skylar explore her options.
Hi, I'm Samantha from Surgery Plus. Skylar was transferred to our team from the representative at Hinge Health. Our intake team explained our process and let her know that she would be assigned a dedicated care advocate. That's where I came in. I provided Skylar with 3 bios for qualified surgeons of excellence for her to review. She took some time to review with her mom, and we worked together to match a surgeon that she was comfortable with, didn't require too much travel. I assured Skylar I would be here to help her through making all of the arrangements and coordinate some of the finer points. I coordinated the transfer of medical records to a prospective surgeon and scheduled the initial consultation and surgical visit once she was comfortable with her choice. Skylar asked about her out-of-pocket cost for the procedure. She wanted to confirm the benefits at no cost. She was relieved to hear her procedure was covered at 100% and that the travel expense would be covered as well. Even better, the travel expense included a caretaker, which meant her mother could stay by her side. Skylar and her mom are very happy about saving a bunch of money on what would have normally had gone towards her deductible and her out-of-pocket.
Hey there, Skylar here. I'm so lucky my mom is a member of the ICUBA medical plan. The support I have received from the start of my college experience from the Blue Cross Blue Shield health coaches and ICUBA Cares pharmacist advocates to help control my asthma turned into something so much more this summer. My Blue Cross Blue Shield health coach identified the need for some extra encouragement and took the time to see I was struggling with the isolation from the pandemic. The free counseling sessions from Aetna Resources for Living were incredible, and I'm in a much better mental state now. I used the 6 sessions and now rely on my strengths and local support groups to stay positive. It was just the push I needed. Hinge Health taught me how to exercise and stretch my knee in everyday settings to reduce and manage my pain and put me in touch with Surgery Plus. The surgeon I used with Surgery Plus was exceptional, and my care advocate answered all of my questions and coordinated everything, even the hotel for my mom and me. My knee is better than ever, and I'll be ready for soccer in the spring. ICUBA Benefits has improved my life for the better, and I plan to use these benefits to the fullest until I turn 26.
Hi, everyone. This is Ted. I was making pretty good progress with my diabetes and a healthy lifestyle, but then a nasty cycling accident really derailed me.
Hi, this is Mike Meredith from Lockton. Due to the severity of Ted's injuries, his case was discussed during our large case management call. This in-depth call includes representatives from Blue Cross Blue Shield and its medical team, including ICUBA's Care-Connected Dedicated Case Manager, Ginger Long, the ICUBA Cares team, and our medical directors at Lockton. We used the time to collaborate on various complex cases and discuss care plans and coordination among our brand partners for the ICUBA members. For Ted's case, our medical director contacted Mayo Clinic for a second opinion on the best way to treat Ted's injuries. Since the Mayo Clinic is in Jacksonville and specializes in neurology and neurosurgery, Ted was transferred to Mayo to treat his closed head injury.
Hi again, this is Sherry from Blue Cross Blue Shield. The Blue Cross Blue Shield health coaching team was already engaged with Ted to manage his diabetes when his case was escalated to me due to the severity of his injuries. Once I received his case, I began managing all of his conditions and immediately focused on developing a plan for his discharge from the Mayo Clinic. I coordinated with each of his doctors and the case manager at Mayo to address all of Ted's needs during his recovery. Together, we developed a treatment plan that included a pain management specialist and a primary care provider who is affiliated with Mayo. I wanted to make sure that any aftercare Ted needed would be seamless. I spoke with Ted to make sure he had friends or family members that would be available to stay at home with him for the next few weeks while he regained his strength. I called and checked on Ted once a week to make sure he was making progress, and he did not have any issues with getting the care he needed while he was recovering. During one of our calls, I let Ted know that I would be referring him to a care manager with Aetna Resources for Living to help him with additional support during recovery.
This is Amy again from Aetna's Resources for Living. I received Ted's information from Ginger at Blue Cross Blue Shield and contacted Ted to provide support during his recovery. After speaking with Ted, it was clear he needed some help coping with the length of his recovery, so I helped him arrange counseling through the EAP benefit. I got the sense that Ted was struggling in some other areas too, so I set up a financial consultation and provided him with the resources for work-life services. Ted mentioned that his brothers were taking turns taking care of him during his recovery, so I provided caregiver resources including work-life packets, home service details, and My Strength information for Ted's family.
This is Dr. Greer from ICUBA Cares. We partner with Optum Rx to help employees with questions about their prescription medication with the goal of improving their overall health. Optum identified Ted as a member with a gap in care because he did not fill his last prescription for insulin. That's our cue at ICUBA Cares. We contacted Ted to find out how we could help him stay adherent with taking his insulin and answer any questions about the new medications. I counseled Ted on the importance of taking his medication as prescribed and asked him if he had any challenges in obtaining his prescriptions. Ted explained his current situation, and I helped him find a pharmacy near him that had same-day home delivery available and explained the mail-order pharmacy benefit available through Optum. Since Ted is diabetic, I reminded him about the necessity to get regular vision and dental exams. Diabetic patients are at an increased risk for blindness, gum diseases, cavities, and tooth loss. Ted mentioned he recently received a reminder about his annual eye exam and also assured me he would follow up with his dentist to schedule a visit.
This is Sherry again from Blue Cross Blue Shield. Ted contacted us to find out if his medical insurance provides any coverage for the 2 teeth he lost in his recent accident. After reviewing Ted's benefits, I let him know sedation and oral surgery to replace his teeth would be covered by his ICUBA medical plan with Blue Cross Blue Shield since the loss was a result of his accident. Ted asked about post-surgical follow-up care, and I let him know he would need to follow up with his dentist for routine visits or care after surgery. I also noticed that Ted was a diabetic and was due for his annual eye exam. Ted was grateful for the reminder and let me know that the pharmacist at ICUBA Cares also reminded him about his eye exam. Before our call ended, I asked Ted if he needed assistance finding an oral surgeon. Ted said he would use the provider search tool at My Health Toolkit and said he would call back if he needed additional assistance.
Hey guys, it's Ted again. The assistance and support I've received since my accident has been phenomenal. I have a long road ahead of me, but the ICUBA benefits have been a lifeline. Ginger from Blue Cross Blue Shield has been a great resource and advocate for me and my brothers as we navigate the recovery. She helped lay out a foolproof care plan and has seamlessly lined everything up with Mayo. I was able to use the free counseling sessions through our EAP program, which I'm now continuing under the Aetna benefit, and also received some very beneficial financial coaching. Before this accident, I never knew how much my mental health was weighing on other parts of my life, and my counselor has helped me more than he will ever know. The ICUBA Cares team has been great with explaining my medications, and the prescription delivery is so convenient. As it relates to my paycheck, Symetra never missed a beat. They are consulting vocational rehab to help me get back to work. I'll be forever grateful to ICUBA and my employer for these great benefits.
Members like Skylar and Ted have found even when it seems that no one cares, ICUBA cares. ICUBA is proud to work with professional, caring brand partners that have been carefully selected to enhance the whole person approach to member care. Whether it's dealing with routine or complex medical claims, planned surgery, physical therapy, dental health, vision concerns, pharmacy advocates, or financial well-being, our brand partners work together in the best interest of all of our members. The whole person approach continues to evolve to link our brand partners together while providing a safety net for every one of our ICUBA members. Knowing that ICUBA Cares can go a long way to member satisfaction and retention for our valuable member organizations.